There are multiple findings. The study's produced over 60 publications to date, and I'll just mention a few of them. Of course, the main reason for doing the study was to investigate risk factors for diabetes, for type 2 diabetes, and that's one question that we've answered, and we have shown that the visceral fat depot is strongly related to risk of developing type 2 diabetes over the 10-year follow-up that occurred during the study among persons who were initially non-diabetic. And when you look at the other fat depots, which were all measured using CT scan imaging, the visceral fat depot is the only depot that's independently related to risk of diabetes. The abdominal subcutaneous fat depot is not. The thigh fat depot is not either, and also general measures of adiposity such as body mass index and waist circumference cease to be associated with diabetes risk once visceral fat area is considered. We've also looked at other cardiometabolic outcomes such as hypertension, and we find that the same thing that we found with diabetes, that the visceral fat depot is the primary driver of risk of this outcome. And also we've noticed as well that an increase in the visceral fat depot is also associated with risk of hypertension. And we've also noted the same findings with regard to the development of metabolic syndrome among persons without metabolic syndrome at baseline, and also impaired glucose tolerance among persons with normal glucose tolerance at baseline.